On the last week of April, the World Health Organization raised the pandemic alarm to level 5, urging all countries to immediately activate their pandemic preparedness plans. But what exactly does this mean?
The federal government has plans through something that they call the Strategic National Stockpile to push these medications that are necessary. The hard part is how do you get those medications to everybody who needs it?
2 years ago, Dr. Abramson and other colleagues conducted a study to find out how different communities would respond in the event of a pandemic. The results were somewhat troublesome.
Many people, especially in the Black and Latino communities, felt that they didn't know people who were in positions of power. They didn't know physicians personally, and they were concerned that they were going to be at the end of the line when it came time for handing out things.
And according to Dr. Abramson, after seeing things like what happened with Katrina, these communities might have a legitimate reason to be concerned that they might be left behind.
And impoverished and socially isolated communities, whether they are purposefully neglected or not, are clearly left on the margins more often than they're included. So I think that part raises all of the reasonable concerns.
A concern that rises among the undocumented community, who might be afraid to get out of the shadows to get help in fear of retaliation.
And so there's a bit of a barrier there. Those are the kinds of things that local public health agencies are very aware of and try to communicate, hopefully as best as they can, to these different elusive communities and hidden populations that in situations like this, there can be no barrier. The public good really has to override sometimes that political interest.
Yet the concerns for these communities go beyond access to care and fear of deportation. There are other things that come into play that might not necessarily be in the minds of public health officials.
A lot of those kids who go to those schools are dependent upon the lunch programs and the free meal programs for their daily nutrition. If those schools close, where are they going to get that nutritional supplement? Where are they going to get that hot meal? It's not clear. And the plans, I don't think, have been completed that would allow for that kind of provision of care. And that is a real concern.
Well, Michelle, you are the expert for preparedness, and can you answer to the topic that Dr. Atkinson mentioned in the video, saying that Latinos do not know people in positions of power, that they do not know where to go when a crisis like this happens? Do you have plans for that community?
Absolutely. The American Red Cross makes preparedness plans for all members of our society. We have preparedness information that is widely available in both English and Spanish.
And can you elaborate a little so that our audience understands what kind of plans are those?
We have checklists for all different kinds of disaster or emergencies. So not only the flu, specifically this flu, but also seasonal flu. But we also take a look at emergencies such as hurricanes and tornadoes or landslides.
But what happens? What happens when a crisis like this happens and the Hispanic community doesn't know where to go? What do you do?
We have a network of local chapters that are grassroots efforts in every community. And those local chapters work on a day-to-day basis with all the different organizations in their areas on how to best reach the populations to handle all these situations you're talking about.
So what do they do? Do they knock the doors?
Exactly.
They call people? What do they do?
They do whatever they need to do to reach their community to get the information out there. Not only is this information available in English and Spanish, but we have it in 7 additional languages that can be downloaded off our website.
Yeah, but you're talking about people having to reach out, to go to the internet. There's nothing that you go to the neighborhoods or you go to the leaders of that community to talk to them?
No, absolutely, we do. That's what I'm saying, is in each community across the nation, whether you're in Idaho or Kansas or Maine or Florida, the local chapter works with professionals, or they look at, whether it's faith groups or community groups, how to best reach the population with the information they need, specific at that time, in a language and in a method that actually reaches people.